So the question is, will it cost lives? That is the concern tonight after news that Regional Medical Center of San Jose is closing its trauma center later this year. Hospital says it's just not being used enough. But as NBC Bay Area's Jocelyn Moran tells us, nurses are worried about the potential impact on the sick and the injured.
We spoke to a nurse who works here. She told us she found out about this in an email on Tuesday morning. One of her main concerns right now, the patients who have come to depend on this hospital.
I've been there for a year and a half.
This came as a shock for Melissa, a nurse at Regional Medical Center of San Jose. She believes losing the trauma center will impact people's lives.
If there is a major accident on Highway 101 or Interstate 280, we are the trauma center that patients are going to come to.
But after August 12th, patients could have to look elsewhere. The closest trauma centers are at Santa Clara Valley Medical and Stanford.
Bay Area traffic, we know how that is, so this could really present a delay in care for some of our patients. It could be life or death.
Not just the trauma center, the hospital also announced it will close its STEMI program.
So a STEMI is a ST elevation MI. These are basically patients who are having active heart attacks. And these are the patients that when they come in, we rush them to the cath lab.
The hospital says its decision to close both the trauma center and the STEMI program is because the number of patients needing those services has been on the decline for several years. On the upswing are the number of patients coming into the ER. In a statement tonight, the hospital tells me, quote, "The need for our emergency services has grown beyond our current capacity. Because of that, we will invest $10 million this year to expand our emergency department, increasing capacity to 63 from 43 beds." Big changes coming to a hospital many in East San Jose depend on, and that has people concerned.
And the patient population that we serve at Regional, it really caters to a certain population in East San Jose. These are patients with low literacy levels, low access to care, and difficulty with trusting healthcare professionals.
In a statement, City Councilman Peter Ortiz says, quote, "For me, it's also personal as the trauma unit acted quickly in the past to save the lives of both of my brothers. I have deep concerns about how this will impact the residents of East San Jose."
We are going to be fighting like hell to keep these services available to our patients.
In San Jose, Jocelyn Moran, NBC Bay Area News.